call the meeting of the Oakland County Board of Commissioners March 18th meeting to Madam Clerk, Lisa Brown, please call the roll.
Commissioners Gershenson.
Here.
Angel.
Here.
Hoffman.
Here.
Jackson.
Here.
Kokendorfer.
Here.
Kowal.
Here.
Kuhn.
Here.
Long.
Here.
Loops.
Here.
Markham.
Here.
McGilvray.
Here.
Middleton. Oh, you have to unmute, Commissioner Middleton.
Somehow unmute.
Okay. Middleton.
Now I'm here.
Thank you. Miller.
Here.
Nelson. Here. Powell.
Here.
Quarles.
Here.
Biz.
Here.
Cobb.
Here.
Weipert.
Here.
Woodward.
Here.
Zach.
Here.
Mr. Chair, you have a quorum and 100% attendance.
100% attendance on our first main voyage of a virtual meeting. We'll talk about that in a moment. So we have a quorum. The next up on the agenda is the invocation to be given by the Honorable Mike Gingell, followed by the pledge. And I will stand and rise to the pledge if it's easier for everybody. Commissioner Gingell, the floor is yours.
Thank you, Mr. Chair. Please bow with me. Dear Lord, we thank you for this day and for the blessings that you give us each and every day. Lord, we pray in these times that you would give this board wisdom and insight into good governance. Lord, we pray for the residents of Oakland County and for our nation, that you would give us patience and that you would keep us healthy and safe and protect us from the virus that's upon us. Lord, just give us
This conference is no longer being recorded.
Give
This
us your
conference
grace.
will now be recorded.
in Jesus' name, amen.
Amen.
All right, I pledge allegiance to the flag
The flag. United States of America.
and to the republic
The Republic stands one nation
under God,
indivisible,
with liberty and
and
justice
justice
for all.
for all.
Excellent. All right, next up, we have approval of the minutes from the March 5th, 2020 meeting. Is there a motion? Moved by Commissioner Miller. Moved by Commissioner Miller, supported by Commissioner McGilvray. Any discussion? All in favor, say aye.
Aye. Aye.
Opposed, say nay. The minutes are approved. Moves us on to approve of the agenda. Is there a motion to approve the agenda? Moved by McGilvray. Commissioner McGilvray, supported by Commissioner Nelson. Any discussion on the agenda? Seeing none, all in favor of approving the agenda, say aye.
Aye.
Opposed, say
Aye.
nay. The agenda is approved. This brings us to communications. Madam Clerk, Lisa Brown, will you please read any communications we've received?
Yes, Mr. Chair, we have two communications this evening. The first is dated March 18th, 2020 to the Oakland County Board of Commissioners, and it is a communication explaining that Chair Woodward used his authority under the board rules in regards to a grant application and the deadlines. This was a grant application for the fiscal year 2020 Title 4E Child and Parent Legal Representation Grant second application. The Oakland County Circuit Court prepared a grant application on behalf of Oakland County in the amount of $996,115. It wasn't possible for the department to submit the application for the full board consideration in accordance with the normal procedures because of timing, but it was reviewed by all the appropriate departments. And Chair Woodward stated in the communication that he has authorized the submission of this grant application. And the second is dated March 14th, And it is from Stacy Woodward, the president of the Royal Oak Public Library Board of Trustees, saying, it says, Chairman Woodward, this email serves as notice to the Oakland County Board of Commissioners that on Friday, March 13th at 4 p.m., the Royal Oak Public Library Board of Trustees held an emergency meeting with less than 18 hours public notice to make pressing decisions related to the COVID-19 outbreak. We are in compliance with the requirements set forth in the Open Meetings Act, including sending this notice to the Oakland County Board of Commissioners within 48 hours of said meeting. And attached is the emergency meeting notice with the explanation, as well as their agenda for the meeting. And those are all the communications for this evening.
Is there a motion to receive the communication? Moved by Commissioner Zach, seconded by Commissioner Lutz. Any discussion on the communications? Seeing none, all in favor of receiving the communication, say aye.
Aye.
Opposed, say nay.
Aye.
The communications are received. And next, I'd like to open the floor up to, we're joined today by our county executive, who's been really leading our Oakland County response. Executive Coulter, are you there with us?
I am.
Fantastic. Well, I'd be happy to give the floor to you for a couple moments just to give general updates, and then we'll get on to the rest of the business of today's meeting.
Well, thanks, Mr. Chair. Let me just briefly tell you where we're at today. And Leanne Stafford, who is our public health officer and who technically declares health emergencies in Oakland County, is also on our call. So she may have more specific information, but the latest information that I had was that we had 60 cases of presumptive positive coronavirus in Oakland County today. That's up from 27 yesterday, a pretty sharp increase. It's not clear if this is simply a result of more testing that is going on. It's certainly partially a result of that, but it's also related to the fact that the cases are no longer just involving travel, whether they be domestic or international, but that the virus is certainly spreading in the community now with contact. And so the extraordinary efforts that we've taken and the governor and the president have taken, I think have been the prudent ones. And it's going to get worse before it gets better. I should mention that several of those individuals who have tested positive are in critical condition. And so your prayers and thoughts for those people and their family are warranted at this time. This is truly unprecedented times for Oakland County. I will also just share with you that I think you can be very proud of the people that we have in our health department, in our emergency operations centers, in our communication staff. I probably shouldn't start listing because I'll forget someone, but they have stepped up and worked around the clock in a very professional and diligent manner. And I think in some regards has been a model for the state in terms of some of the things we're doing, especially around the communications. We have had teleconference communications just today with the leaders of our county's senior centers and adult living centers. Yesterday, we met with the mayors and supervisors, the countywide elected officials. We did a town hall just for senior citizens in Oakland County 2 nights ago that had over 5,000 participants. So people are very interested in this information, and Kathy Forsley was on that call and just gives very good, clear, calming advice. And I think it's gone a long way to get us to the point where people aren't panicked, but they're taking this very seriously. And so I just want to thank all of our staff in all the departments who are adjusting, including the other countywide officials who are adjusting their operations and kind of making up some of this on the fly. And then finally, the Board of Commissioners for your support that you've given us both financially and in other ways, and being just good, neutral, calm information givers in your communities, I think goes a long way. And so I want to thank you for all of your support as we move through this. None of us know how long this will last. That's still the great unknown, but we do know it'll get worse before it gets better. And so with your support and help and our constant communication and partnership, we will get through this together. So thank you, Mr. Chairman.
Thank you, Executive Coulter. Thank you for that update. Did Leanne wanted to offer any additional comments?
No, I think he got all the great points. The only thing I would encourage too is that we have some great toolkits out there that are on our website that really reflect across multiple sectors. And we really request that you all get those out to the people in your area, especially if they're into those individual sectors. But there's also a great general public toolkit that we would like to try to get that out to as many people as possible.
Great, thank you. I'm going to open up a couple questions from commissioners to the executive and you, Leanne. First up, I'm going to recognize Commissioner Shelley Tom.
I'm sorry, but I didn't hear, Mr. Executive, what our numbers are today. I apologize.
Yes, we are at 60 presumptive cases, up from 27 yesterday. So a steady increase, as is being reported around the state, but Oakland County has the most cases in the state. Clear explanation for that is not known. Could be that we just traveled more, or but it's not clear. But we have the most cases in the state as of today.
Okay, I have another question, if I may, Mr. Chair.
Yes, you may.
Follow up on that. We are going to probably appropriate $1 million more for the coronavirus implementation. Will you be putting together a plan for us so that when it becomes necessary, we can help those who truly need it? There are people who are living paycheck to paycheck, people who've lost their jobs, who have mouths to feed and such.
Yes. So, yes, and as you can imagine, there's a great need in our county. I've spent a lot of the last couple of days just touching base with the leaders of our nonprofit organizations, our hospital systems, and the needs are emerging. But I do commit to you that we will continue to communicate with the board, even in the instances where we have authority to make those expenditures. We will keep you informed of those. We'll do this in collaboration with you. In fact, just before this meeting, I shared with both the chairman of the board and Mike Ingel, the minority chair, a tentative draft plan that we're talking about implementing around our own internal employees to manage them. There will be costs involved in these, but we'll continue to have that dialogue and conversation with you as we move through this.
Thank you. Thank you very much, Mr. Executive and Mr. Chair.
Thank you. Any other commissioners would like to ask the executive or our chief medical officer any questions? Commissioner Zach.
So I am getting questions about knowing where, these cases are located and details. And when we had the measles, we were tracking people. Can we talk about any of the exposure places? We did that initially, or just too many?
I've learned this answer, but I'm not the health expert. So Leanne, do you want to give the explanation for how we process those situations?
Yes. COVID-19 is very different than measles, but when we started the first few cases, we started pushing out these sites really in an abundance of caution. More than likely a very low exposure possibility. But now, because we have so many cases, if there's a big exposure to something that we feel like we need to get out there, we would use the internet to do that. But most of the time, actually pretty much all the cases that we're aware of and we've followed up with have been a situation where we can contact each of the individuals that may have been exposed and been able to address what those cases are. So You want to add?
And this is Kathy Forsley. Just to add a thought is that for measles, it was a little different in that we had the opportunity in some cases to offer prophylaxis or vaccine to prevent the illness. We have nothing like that to offer. Instead, what we have to offer is to watch for signs and symptoms. But we really have approached a point where just providing those locations, and to be fair, it is spread in the community now. Everyone needs to be watchful of those signs and symptoms. And I think we're getting quickly to the point where putting additional locations out is probably a little going to become misguiding in that those are not the only locations that you should be looking for signs.
Thank you.
Thank you. Commissioner Powell is next. Commissioner Powell, the floor is yours.
Actually, Helene asked the same question I was about to ask, so thank you, Ms. Zach.
Thank you. Anybody else? Any other questions? Commissioner Miller.
Thank you, Chair. I just want to make a statement that I was on that call as well as Commissioner Loops, and the community involvement questions and the answers were amazing. So hats off to the executive for doing those calls in the health department. I appreciate it, and I hope we have more in the future.
Thank you.
Thank you, Commissioner Miller, and we intend to. In fact, we're going to have another town hall tomorrow evening at 7 p.m. And we've promised to all the groups that we've done these with that we'll continue to do them regularly as needed and, you know, as the conditions merit. So appreciate it, and thank you for being on the call yesterday.
All right, last call for questions to the executive or the executive team. Seeing none, thank you. Thank you, Executive Coulter, Leanne, Kathy, all of you. You guys are doing incredible work. Keep up the good work.
Thank you, Mr. Chair.
Next, I guess just related to communications, I mean, I just think for any of the audience that's joining us here, I believe Oakland County may be the very first government engaging in holding a virtual meeting, a video conference meeting to conduct the business here. We are doing this in respect, in accordance to the governor's executive order to minimize group gatherings. There's 21 of us here on this this meeting alone, and so when you add staff and you add the public, I mean, we can hit 50 pretty quickly. So the governor's executive order, as well as guidance, and as recent as an hour and a half ago, the most recent executive order giving guidance on Open Meetings Act that we are in compliance with, in addition to the CDC, the Center for Disease Control recommendations and advice of our health department. We are practicing social distancing, and I appreciate all the commissioners that put in the extra work to get comfortable using this technology so that we may be able to conduct the business. Some of the emergency actions that we're taking today to help support Oakland County's effort to combat this, the spread of COVID-19. With that, I'm going to move on to the next part of our agenda, which is public comment. We had invited the, in accordance to the recommendations and the Open Meetings Act, took extraordinary steps to ensure the public could be able to participate, to give feedback, address the board as if in any other board meeting. We allowed the public to send emails that we will read in a moment, for any emails that came through, as well as create a mechanism that should anyone show up. I'm the only person in the auditorium, but if any member of the public showed up, that they were in a position to be able to video conference directly into this and participate as if any other meeting. So I'm going to ask staff to read the emails that came in as it relates to the public comment at the request of this. And then I will open up for any other public comment of anybody else in the audience.
Okay, the first public comment is from Julie Braun. She said, I'm afraid the governor will close K-12 schools before April 15th. I can't imagine there's a sufficient data to make informed decisions with such incredible far-reaching impact. I don't think anyone is giving any consideration to the emotional health of our children. By mid-April, we'll see if this pandemic is proving to be as bad as previous ones in our history, and only in 2 to 3 weeks will we know if a long-term closing is necessary. please petition the governor to not make any hasty decision. The next public comment is from Anonymous. They state, please advise why, after multiple announcements from the county officials, the Board of Commissioners has not yet considered and approved the results of the compensation study. Additionally, please provide timeline for when the matter will be considered. Public comment from online.
Okay, so those were the two. If you shut it down. The pursuant to our rules require people to identify themselves. We didn't make that clear for the emails that we received, and so that's why anonymous was allowed to be read, but in the future we'll make that clarification. I will open up for any further public comment. And I'm alone in this chamber. So I will declare public comment closed. It moves us on to reports of standing committees. First up, we have the consent agenda. Is there a motion to adopt the consent agenda?
So moved,
By
Hoffman.
Commissioner Lubes, seconded by Commissioner Hoffman. Any discussion on the consent agenda? Seeing none, if everyone can unmute, we're going to call roll. Commissioner, County Clerk
Me,
Lisa
yeah, it's
Brown,
okay.
please call the roll.
Okay, on the consent agenda, Commissioners Gingell,
Yes.
Hoffman,
Yes.
Jackson,
Yes.
Pokendurfer,
Yes.
Kowal,
Yes.
Kuhn,
Yes.
Long,
Yes.
Lubes,
Yes.
Markham,
Yes.
McGilvray,
Yes.
Middleton,
Yes.
Miller,
Yes.
Nelson,
Yes.
Powell,
Yes.
Quarles, Quarles? Is that a yes?
Commissioner Quarles, can you confirm that was a yes?
It was a yes.
Okay, thank you. Spiz,
Yes.
Cobb, Cobb,
You're on mute, Commissioner Taub. You're on mute, Commissioner Taub.
I know I am, but I cannot control.
Okay, so yes, we can hear you.
Okay.
Okay.
I'm on the, thank you.
Okay, do you vote yes to approve the consent agenda?
Yes.
thank you. Wypert,
Yes.
Woodward,
Yes.
Zach,
Yes.
Gershenson.
Yes.
Mr. Chair, you have 21 yeas, 0 nays.
A sufficient number voted in the affirmative, the consent agenda is adopted. Excuse me. It brings us to the regular agenda. There is no business under Economic Growth and Infrastructure Committee. There's nothing under the Finance Committee. Our first item is under Healthy Communities Environment Committee. Commissioner Penny Lubes, let me open the floor. And
Hi, yeah, thank you. We met and discussed the agreement between the County of Oakland and Honor Community Health for integrated health care. We spoke about a dollar amount, but we also have an amendment now. Is now the time to introduce the amendment?
so, well, first, moved by Commissioner Lubes, seconded by Commissioner Nelson to receive the report. All in favor of receiving the report, say aye.
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 Opposed, say nay. The report is received. I now move by Commissioner Lubes, seconded by Commissioner Nelson to move the resolution. And I'll recognize Commissioner Lubes again. There is an amendment to the resolution that is on everyone's packet. The
The
move by
amendment,
Commissioner
it-
Lubes.
yes.
Yep. Go ahead. Oh, Commissioner Lubes,
Sorry.
seconded by Commissioner Zach. Commissioner
The
Lutz.
amendment is to the nurse education, practice, quality and retention register.
Point of order, Mr. Chair.
Okay, well, hold on one second. Yes. Commissioner Kowal, point of order. What is your point of order?
Yes, I'm not sure which comes first, but I'm moving to postpone this resolution.
And I would like to second that, Long.
All right, so, okay, so well, we had a motion on the amendment that was seconded. And now we have a motion by Commissioner Kowal, seconded by Commissioner Long to postpone this item entirely. Is that correct?
Correct.
Okay. Any discussion on postponement? Who wants to raise their hand? All right, okay, so if you raise your hand, I will write you down. So we're going to speak to postponement. And then we'll come back to the amendment depending on how the vote happens. So Commissioner Middleton, followed
Dave,
by.
write me down too, Long. Write me down
Okay.
too, please.
All right, Commissioner Middleton,
Thank you.
followed by Kowal, followed by Long. And then we'll take more. If you just raise your hand, I'll write you down. So Commissioner Middleton.
Yes, the resolution was amended and the amendment says, be it further resolved that the Oakland County Health Department shall submit a copy of the agreement to the Finance Committee for review and approval, and the Healthy Community Environment Committee to be received and filed. That hasn't happened yet. So how can we vote on this resolution when it's not complete yet? Because Finance hasn't gotten the final contract back yet.
If it's okay, Commissioner Kowal, if I can answer that, and then I'll hand it over to Commissioner Kowal. In committee, the amendment that Commissioner Middleton referenced was to have the contract come back at a future date after the resolution was adopted. We haven't adopted the resolution yet. Instead, to go even further, the contract language was sent out to everybody on Monday, and the amendment that Commissioner Lubes was offering is actually bringing the entire contract into the resolution, so you're doing it all at once. That's the answer to the question. Commissioner Middleton on that point.
Yes, in Finance, we took a recess and drafted this amendment. And Commissioner Kowal and Commissioner Long worked with the administration, and our interpretation of that was that before this resolution moved, it would come back and we could review the items that were in the contract. Now, it's pretty low if we were drafted an amendment that really meant nothing then, because you're saying that Finance Committee would have okayed the contract anyway. So if that amendment meant nothing, that's just wrong. That's all there is. Okay.
I mean, if I may just respond to that, there was questions people wanted to see the contract. We have the contract. We can incorporate that in with everything that was sent out to all commissioners. If people would prefer to keep the resolution as is and have the contract come back another time, that's fine too, but there is no action to be had if we don't adopt the resolution that the amendment was on. So let me allow, we have other people who are, in the queue here, so let me pass it on to Commissioner Kowal, followed by Commissioner Long, then followed by Commissioner Tao.
Well, thank you, Mr. Chair. I'm reading the amendment right here. It says for review and approval, not just for review. I mean, how do you approve something after the fact, after it's all done? So to me, it's a question of process here. I actually felt more comfortable voting for this resolution and to go forward with the Honored Healthcare with this amendment in place. And I want to be absolutely sure that the Oakland County taxpayers would not be paying any more than the $4 million that was proposed here. And I wanted, we voted on this amendment, we took a roll call vote, it passed, and now it's kind of just being, so I have to say, that I think that we're not following process here. Thank you.
Commissioner Kowal. Commissioner Long.
Thank you, Chairman Woodward, and I agree with Commissioner Colwell. It was my thought that the contract was going to come back to finance before we put the resolution, voted on the resolution. And also, some of the fellow commissioners, I think, did not have time to see the contract at all. And another thing is, in our Republican caucus, I think many people would vote yes, seeing the presentation that they gave, honors presentation, because that certainly changed my mind. And I think that if we postponed it, we could probably get 100% of the commission, or just about, to vote for this. So that is my reason for seconding the postponement. I would rather have us all on board with this important decision.
Thank you, Commissioner Long.
That's all for me right now.
Commissioner Taub.
No, thank you.
Say that again, Cheryl.
I'm going to pass. Can you hear me?
Oh, okay. Any further discussion on postponement? Commissioner Zach.
So, as Chair of Finance, we talked about seeing the contract at a future date, but I'm reading this amendment and, as far as I understand it, we can easily vote yes for it today. We will have the opportunity to see the contract. The fiscal amount that we're spending, I heard some concerns from Commissioner Kowal, is listed on this amendment, not to exceed $4 million. And we do have a planned use of fund balance fiscal piece attached to this. And we were submitted a copy of the presentation more than a week ago. And I would think that all of the commissioners had the opportunity to look at the PowerPoint, which was, I agree, very effective. So I see no reason to postpone it. I also think that more than ever, we need health services. We need to move forward on this creative program sooner versus later. I don't want to delay building out the offices any longer than we have to. So I think it's urgent that we vote on this today.
Thank you, Commissioner
Thank you.
Zach. I'm going to ask staff, ask our Chief of Staff, Chris Ward, to explain the contract that's before us that we're trying to incorporate into this so that everyone has it, that was distributed to everybody, and help frame like the two choices that we have before us. So,
Yeah, thanks,
Mr. Ward.
Mr. Chair, because I worked with Commissioners Kowal and Long on drafting that amendment. This is, I think, maybe a little confusion. The amendment in finance was to have the contract come back to finance, as was mentioned, for final approval and also to go to Healthy Communities for receive and file. So the difference here is we got the finalized contract, and the amendment is to incorporate all of the terms and conditions of that contract as a condition of your appropriation. So the concept here is why have it come back to finance if you have the finalized contract? If you're more comfortable with having it go back to finance, as was the finalized version of this as came out of finance, then it would just have Commissioner Lubes withdraw her amendment, whatever the commission is most comfortable with. But again, it just seemed more logical if we have a finalized contract for the Board of Commissioners to adopt an amendment and attach this as a condition of your appropriations.
Thank you, Mr. Ward, for that explanation. I see you got Commissioner Gingell. If anyone else wants to speak, if you just raise your hand, I'll put you on the list.
Thank you, Mr. Chair. I just want to make 2 points here. I've spoken with a number of members of the Republican caucus, and I think there are 2 primary concerns beyond the process that we believe was supposed to be followed through the amendment in finance. The first question was the types of services that will be provided through the county clinics. And in particular, it's specifically around abortion-related services. But I know that I spoke with you earlier, and that based on the federal qualified healthcare centers, that they actually are not allowed to provide these types of services, but just basic family planning. So I think it might be helpful if we confirm that, even though it's not written expressly in the resolution or the contract from what I saw. So I believe our conversation was that that is correct. Is that right?
As it relates to the postponement, the contract talks about family planning services. Family planning services as defined by the federal government, Title 10 services specifically, do not allow for providing abortions. And it was expressly made clear in the committees, in the Legislative Affairs and Government Operations Committee, as well as the, Healthy Communities Committee, as well as Finance Committee, that that was the case.
Yeah. Great, thank you. The other item that I wanted to just bring forward is that, we're certainly in the middle of a pandemic situation. The county executive joined our call to talk about it. We know we've appropriated $500,000. There's a request for another $1 million, which will wipe out our pandemic line item in the budget. And I think part of the position is it prudent right now to commit $4 million to build out these clinics in the time where we're not uncertain about what is to come, and we may need dollars to be appropriated towards a pandemic response. And it's, the question is the timeliness of this and the necessity of it. So I'm not trying to debate it. I'm just trying to explain part of the reason why why we're putting forth the issue to postpone.
I understand. All right. Any further discussion on postponement? We've drifted a little bit discussing the policy matter at hand, but any discussion on postponement? I'm going to be voting no to postpone for the reason that we had two committees that discussed this. It was done in public, but the presentation's available online, as well as the contract in question has been circulated to all members that expressly puts a cap limit on it. Commissioner Kokendorfer.
Thank you, Mr. Chair. Just briefly, just for clarification, the contract amendment that's being executed was circulated via email roughly 48 hours ago. But the original contract that's actually being amended, I didn't receive that in that email. I did request it. I haven't received it to date, and that's no fault of staff, only because they've been so busy trying to deal with follow of the coronavirus. So I have not seen the original contract that's actually being amended.
If I could answer that. So it's a contract amendment to our existing contract with Honor Health for the services we already have with Honor Health. And have, I think that, their dental services, et cetera. That's why it's a contract amendment.
Commissioner Kokendorfer.
Thank you, Mr. Chair. Well, I think that was actually one of the motivation behind Commissioner Long and Commissioner Kowal seeking for this to go back to the Finance Committee, just so we could look at all of those relevant documents and make sure it received a thorough discussion. That's all.
Sure. So, if that's a concern, perhaps the best thing to do would be to have Commissioner Lubes withdraw our amendment and have it go back to committee rather than have the attachment.
So any further discussion on postponement? Seeing none, we're going to call the roll on postponement. Madam Clerk, please call the roll.
On postponement, Commissioners Hoffman,
Yes.
Commissioner Hoffman, you're on mute.
Commissioner Hoffman,
On postponement, Commissioner Hoffman.
I'm sorry, I didn't hear. What's the, is this the
Motion.
motion to postpone?
Correct.
I say yes.
Commissioners Jackson,
I say no. No.
Kokendorfer, Kowal,
Yes.
Kuhn,
Yes.
Long,
Yes.
Lubes,
No.
Markham,
No.
McGilvray,
No.
Middleton,
Yes.
Miller,
No.
Nelson,
No.
Powell,
Yes. I mean, no, sorry.
Okay. Quarles,
No.
Spiz,
Yes.
Taub,
Yes.
Whitebirch,
Yes.
Woodward,
No.
Zach,
No.
Gershenson,
No.
Gingell.
Yes.
Mr. Chair, you have 10 yeas, 11 nays.
An insufficient number voted in the affirmative. The motion to postpone fails. That brings us to the amendment that was offered by Lube, seconded by Nelson, to amend. Any discussion on this amendment? And at this point, I guess I would offer to my Republican colleagues, if we withdrew this amendment, is it okay to move forward? And then the contract that we all have will be brought formally through the committee process.
Who's that?
So Commissioner Spiz, then Commissioner Kowal. Commissioner Spiz.
Can you please reread the amendment, please?
So the current amendment, or the amendment that we amended in committee?
The one that Penny is
right
on the floor.
Yes.
Oh, my gosh.
I think I have it here.
It's
All right, here we go.
the
I have it right here.
Okay.
It would be easier,
Yeah.
Commissioner. Okay.
I plugged
So
my phone
the
in now.
amendment, at the back of it's part of the the online agenda. It basically strikes out the things that we added, like kind of the changes we made in committee, and inserts, now therefore be it resolved that the Oakland County Board of Commissioners approves the attached contract amendment and exhibits between the County of Oakland and Oakland Integrated Health Network. Authorization for all appropriations are contingent upon continued conformance with the terms, conditions, and deliverables as defined in the contract amendment and exhibits attached. And all of you have all of that stuff is what was sent out to everybody.
Do you know what page in the packet it is?
It's at the back end of. I'm gonna pull up the page.
I can't find it.
Yeah.
Page 83.
Page
Thank you.
83. Thank you. So
84, I'm sorry.
So what is the will of the girl? Okay, Commissioner Spiz. Then we go to Commissioner Kowal. We can come back to you, Commissioner Spiz, if you have any questions. Commissioner Kowal.
I'm still looking for it. I'm sorry. Give me a minute here.
All right. Mr. Gingell.
Maybe we could just talk about what the material change the amendment puts in place, what's significant about it. And then the other thing is, regardless of that, I think the position of the minority caucus is that we still believe it would be prudent to not commit to the $4 million at this time. And, regardless if the amendment occurs and then we're voting on the resolution as amended, I still believe it's the position of the Republican caucus that it's not prudent to spend the money when we know we're in the middle of a pandemic.
Okay. Duly noted, Commissioner Gingell. I'm going to keep it focused on the amendment at hand, and we can take up that matter pending a vote on this. Any further conversation about the clarification on the amendment? Commissioner Middleton.
Yes, this amendment just basically strikes the amendment that we put on in committee. Is that correct?
In clarification to Commissioner Middleton's comments, it's the goal of the amendment in committee was to make certain that the full contract came before the Finance Committee. In this case, the full contract's coming before the entire board, so it's even more commissioners. And since all the requested information is before the contract and all the exhibits attached that were distributed to all commissioners, thinking is that we make sure that these are adhered to, and that's why we're able to move forward. So the amendment that was adopted in committee, in the Finance Committee, was please bring all this back to the Finance Committee. Staff, Corporation Counsel, and everybody pulled all this stuff together so that every commissioner will see this, and we can approve it all as one. Commissioner Taub.
Yes, I cannot support this. I'm having an echo, and I do apologize.
We hear you.
However, you know, we're denigrating the whole committee process. Maybe we ought to just act as a committee of the whole and forget the finance committee, which in the past has kept us whole financially. I don't get it. I just don't understand it. So I'm a no on this whole thing. Thank you,
Okay.
Mr. Chair.
Commissioner Middleton, for a second time, Commissioner Spiz following him. Commissioner Middleton, on the amendment.
Thank you, Mr. Chair. I brought it up, it's on page 84. The resolution, the amendment that we added has a line through every part of that amendment. So the question I asked you earlier, this amendment completely strikes the amendment that we negotiated and put in on the at the finance meeting, and I think it passed 100%. And now you're crossing it out. Is that correct?
Commissioner Middleton, if you remember, you voted against this resolution in committee. The
I did not
change,
vote against the amendment.
no, but you voted against the final resolution. The amendment asks to have all the contract documents and all the related supporting materials to be brought before everybody. And that's what this amendment does. It brings the it brings the contract. It brings all the information that was requested in that amendment before the entire board. Commissioner Spiz. Commissioner Spiz, I think you're on mute there.
Yeah,
Commissioner
I'm
Spitz.
sorry. I'm still trying to reread through this again because I'm confused. I don't necessarily understand why we're striking the first, therefore be it resolved. So I'm trying to understand it. And
Okay. So
also
let
it
me,
says the attached contract.
the
Clarify,
first be before the resolve stated that the Oakland County Health Department shall submit a copy of the executed agreement to the Healthy Communities Environment Committee to be received and filed. This amendment incorporates all of those documents. The now therefore be resolved clause as strikes said that we authorize the department to enter into the agreement to implement the comprehensive plan and provide integrated health services, primary care, family planning, and behavioral health services in accordance with the policies and procedures of the Compliance Office Purchasing and Review of Corporation Council. Redundant claim because all of those documents are part of this amendment. All the documents that were sent out to everybody on Monday, all of that's included.
my only thought is, don't we still need to approve entering into that contract prior to approving the contract?
The resolution authorizes that. The whole resolution authorizes that. Any
All right,
further
thank you.
discussion on the amendment? Seeing none, I'm going to be supporting the amendment because I think it brings forth the contract. I think this board has been very committed to making sure that contracts of certain amounts come before this board. I mean, and now we have a case that this is the case. This is an amendment to an existing contract for other services, not duplication of those services. This is for specifically the services that are outlined as that both the Healthy Communities and the Finance Committee reviewed. So I will be supporting this amendment. Seeing no further discussion, Madam Clerk, will you call the roll?
On the amendment, Commissioners Jackson, Jackson?
I'm sorry. Yes.
Thank you. Kokendorfer,
No.
Kowal,
No.
Kuhn,
No.
Long,
No.
Lubes,
Yes.
Markham,
Yes.
McGilvray,
Yes.
Middleton,
No.
Miller,
Yes.
Nelson,
Yes.
Howell,
Yes.
Quarles,
Yes.
Biz,
No.
Taub,
No.
Whitebird,
No.
Woodward,
Yes.
Dash,
Yes.
Gershenson,
Yes.
Gingell,
No.
Hoffman.
No.
Mr. Chair, you have 11 yeas, 10 nays.
Sufficient number of voting in the affirmative, the amendment is adopted. Brings us to the main motion. Is there any further discussion on the main motion? Seeing none, I think we've talked about it a lot in the previous discussion. Oh, Commissioner Taub.
Mr. Chair, I have a question too.
Try it again. Okay.
Okay,
Commissioner-
I'm sorry about the echoing.
Mhm.
However, I can't support this. I can't put $4 million in a pot when I know that there are people in Oakland County who will be or who are struggling, families who have been impacted by the virus. I'm not voting for this, not because it's not a good idea, but because I think we can postpone this until we get through this pandemic. Thank you, Mr. Chair.
Thank you, Commissioner Taub. Commissioner Bid, where'd you go?
Yes, just a couple, probably just one question. Noticing, going back to the original resolution, do we have timing for phase 2, 3, and 4? Since it's separated in phases? Is there dates set to those? I'm assuming phase 1 is immediate.
I would say phase one's immediate. I think in the health department, I think this was a conversation that was presented both in the committees that people can go back and watch what the phases are, with the goal for this whole initiative to be self-supporting over a period of 4 years, hopefully before 4 years. Commissioner
Do we have a
Kowal.
time, do we have a, I'm sorry, do we have a time frame for the expenditures of monies over that time frame?
I think it's been mentioned, let me just mention that this we reserved $4 million for this initiative last year. This is only a portion of that for the contract with Honor Health. There are capital outlay for the exam rooms, which are also distributed to everybody. That will come forward in a separate resolution. So that will be another topic for another day.
Commissioner Woodward, this is Jody Hall.
Oh, hey Jody, how are you?
Good. I'm sorry. I did to answer the question, Exhibit 10 has a specific table that lists all the payments. If you look in there, there's a table that lists the dates for all the payments of the contract.
That's on page 93.
Commissioner Kowal, then Commissioner Gingell. Commissioner Kowal.
Thank you, Mr. Chair. I just wanted to say that I agree with Commissioner Taub that we have no idea what we're dealing yet with COVID-19. And that's why I feel like, aside from the procedural issue, that we should hit the pause button on this for a little bit. Thank you.
Thank you, Commissioner Kowal. Commissioner Gingell.
Thank you, Mr. Chair. I just was going to echo Commissioner Kowal's comments about being prudent in these times of crisis and making sure we're not getting over our skis and spending. But I also want to reinforce the point that the action tonight commits us to roughly $4 million. And if I just heard you correctly, that's not the end. There'll be a supplementary resolution that comes back from what I heard in the range of $1.5 to $2 million minimum to complete the build out of what we're engaging in here. So tonight, we're not necessarily just committing to roughly 4 million. It's probably more likely like 6 million, because once we're halfway in the water, we're not coming out on the clinic build. So I think that's just an important measure for us all to be considering on this vote.
Thank you, Commissioner Gingell. I just have a clarification that this agreement speaks to the $2.4 million contract with Honor Health. The remaining amount for build out would come forth in another resolution. That expenditure is capped at $4 million because that's the money that we spent for this initiative last year. Commissioner Powell. Unmute.
I was trying to follow what you were saying. So the only line that I seen was that 2.3. What else is R. Gingell referencing?
So we reserve, and Commissioner Gingell can correct me if I'm wrong. We reserved $4 million end of last year for this initiative. and we have set aside fund balance to do this. We are appropriating with this resolution the $2.4 million for the contract with Honor Health. The remaining 1.7 million, which is a very high estimate of the construction costs for the build out of the exams, that will come back with another resolution for a total amount of $4 million. No one is talking $6 million.
Okay, thank you for the clarity.
All right, thank you. All right, any further discussion on the resolution? Seeing none. I'm gonna have to just disagree with some of my colleagues. I think this is the right thing to do right now. If there's one thing in the recent days that we have seen on full display, the importance of public health, and this initiative strengthens public health in Oakland County, and I believe is the right thing to do. Seeing no further discussion, Madam Clerk, please call the roll.
On the resolution, Commissioners Kokender first,
No.
Kowal,
No.
Kuhn,
No.
Long,
No.
Lubes,
Yes.
Markham,
Yes.
McGilvray,
Yes.
Middleton,
No.
Miller,
Yes.
Nelson,
Yes.
Howell,
Yes.
Quarles,
Commissioner Quarles?
Quarles,
Commissioner Quarles? Can you hear you?
Yes.
if you could please mute unless I'm calling your name, I would appreciate it. Thank you. We're getting a lot of other chatter. Spiz,
No.
Taub,
Billy Taub demonstrated for no. She said no. Billy Taub said no.
right, but I have to hear her say no.
Can you see it say no?
No, well, I can't see her. Okay, thank you.
Kelly Taub, can you say it again?
No.
Thank you. Whitebert,
No.
Woodward,
Yes.
Zach,
Yes.
Gershenson,
Okay, so right now, over here, there's a Pac-Man rental container.
Commissioner,
That's also gonna be
Commissioner
going
Christensen,
back.
you're muted.
It's just a rental, so I'll also
okay,
also
Hoffman,
be
if you
sending
could
that
please.
back.
Okay, who's
No.
talking?
Hoffman, no.
No, I wasn't calling you. I thought that you were. I can hear background noise.
Yeah.
Some people are having other
Shut their
conversations.
phones off.
Who's
So everybody, I'm
somebody should
gonna
be able
mute
to mute
everybody. If you don't mute yourself, I'm gonna mute you for you.
Yeah,
Commissioner
mute him.
Gershenson, you're muted.
I know. I already voted.
Oh, no, I didn't hear you, Gershenson.
Oh, I'm sorry. Yes.
Thank you. Gingell,
No.
Hoffman,
No.
Jackson.
Yes.
Thank you. Mr. Chair, you have 11 yays, 10 nays.
A sufficient number voted in the affirmative, the resolution is adopted. That moves us on to the next committee, Legislative Affairs and Government Operations, where there is no business. Public Safety, Social Justice Committee, where there is no business. That brings us to the reports and special committees. So we have a number of resolutions to bring forward, and I just need to check. Mr. Ward, do we have them in the system?
Chair? Mr. Chair,
Yes, Commissioner Tao.
I would like to postpone my motion to discharge
Okay, so
to the next board meeting. Thank you.
okay, your resolutions? Both of them? I just want to make sure I have the right ones. So there is the resolution. Oh, okay, so,
She's postponing her motion to discharge.
oh, you're okay, got it. I'm sorry, okay. Board Senate Committee, special order of business, you're moving to give notice to discharge miscellaneous resolution 19248 to the next board meeting. Duly noted without objection. Brings us to unfinished business, brings us to new and miscellaneous business. Staff? Maybe one of you have answered. Are they supposed to be in a certain order? Okay, all right. So we have, I think, 6 resolutions that we're gonna be asking requests for suspension of the rules for immediate consideration. I'm going to start with Commissioner Taub. The resolution for Oakland County designation of the week of Sunday, April 19th through Sunday, April 26th as days of remembrance, and Tuesday, April 21st, 2020 as the day of remembrance of the victims of the Holocaust. So,
Thank you,
yes, Commissioner
thank
Taub.
you, Mr. Chair, thank you for reading that.
So Commissioner Taub moves to suspend the rules for immediate consideration of that. Is there a second? Seconded by Commissioner Zach. Any discussion? Any discussion? Oh, that's not a debatable motion. All in favor of suspending the rules to take up this resolution, say aye.
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 Opposed, say nay. The rules are suspended. Commissioner Taub moves the resolution, designation of the week, and the day of remembrance for the victims of the Holocaust, moved by Commissioner Taub, seconded by Commissioner Zach. Any discussion? Seeing none, Madam Clerk, please call the roll.
On the resolution, Commissioners Kowal,
Yes.
Kuhn,
Yes.
Long,
Yes.
Lubes,
Yes.
Markham,
Yes.
McGilvray,
Yes.
Middleton,
Yes.
Miller,
Yes.
Nelson,
Yes.
Powell,
Yes.
Quarles,
Let me skip over her. I don't see her in front of the camera. She'll be back.
I'm back. Spiz,
Yes.
Bob, Whitebird,
Yes.
Woodward,
Yes.
Zach,
Yes.
Gershenson,
Yes.
Gingell,
Yes.
Hoffman,
Yes.
Jackson,
Yes.
Kokendorfer,
Yes.
Quarles,
Commissioner Quarles? Going once, going twice. No, she's not gonna be voting.
Okay. Mr. Chair, you have 20 yeas, 0 nays.
A sufficient number voted in the affirmative, the resolution is adopted. Commissioner Taub, would you like to do your other resolution?
I would like you to read it, Mr. Chair, if you would, please.
Certainly. Commissioner Taub is going to ask for a request the suspension of the rules under new business, a resolution designating April 24th, 2020 as Armenian Martyrs Day in Oakland County. Shelley, Commissioner Taub moves to suspend the rules. Is there a second? Second by Commissioner Spiz. All in favor of suspend the rules, say aye.
Aye.
Aye. Opposed, nay. The rules are suspended. Moved by Commissioner Taub, seconded by Commissioner Spiz to adopt the resolution. Any discussion? Seeing none, Madam Clerk, please call the roll.
On the resolution, Commissioners Kuhn,
Yes.
Long,
Yes.
Lubes,
Yes.
Markham,
Yes.
McGilvray,
Yes.
Middleton,
Yes.
Miller,
Yes.
Nelson,
Yes.
Powell,
Yes.
Quarles,
Yes.
Spiz,
Yes.
Cobb,
Yes.
Whitebird,
Yes.
Woodward,
Yes.
Zach,
Yes.
Gershenson,
Yes.
Gingell,
Yes.
Hoffman,
Yes.
Jackson,
Yes.
Kokendorfer,
Yes.
Kowal.
Yes.
Mr. Chair, you have 21 yeas, 0 nays.
A sufficient number voted in the affirmative, the resolution is adopted. I'm going to move to Commissioner Kowal. You have a resolution. You want to read it? You want me to read it?
I'll let you go ahead and read it, Mr. Chair.
All right. Commissioner Kowal moves to request to suspend the board rules for immediate consideration and new business. Tri-Party Road Improvement Program Fiscal Year Appropriation 2020 Appropriation Charter Township of White Lake, spreading of gravel and chloride on various roads, project number 55652. Moved by Commissioner Kowal, seconded by Commissioner Spiz, to suspend the rules. All in favor of suspending the rules, say aye.
Aye.
Opposed, nay. The rules are suspended. Commissioner Kowal moves, seconded by Spiz, to approve the resolution. Any discussion on the resolution? Seeing none, Madam Clerk, please call the roll.
On the resolution, Commissioners Long,
Yes.
Lubes,
Yes.
Markham,
Yes.
McGilvray,
Yes.
Middleton,
Yes.
Miller,
Yes.
Nelson,
Yes.
Howell,
Yes.
Quarles,
Yes.
Biz,
Yes.
Taub,
Yes.
Whitebird,
Yes.
Woodward,
Yes.
Zach,
Yes.
Gershenson,
Yes.
Gingell,
Yes.
Hoffman,
Yes.
Jackson, Jackson,
Yes.
oh, thank you. Kokendorfer,
Mm-hmm.
Yes.
Kowal,
Yes.
Kuhn.
Yes.
Mr. Chair, you have 21 yeas, 0 nays.
A sufficient number voting in the affirmative, the resolution is adopted. The next resolution I'm going to bring forward is offered by Commissioner Gershenson, Adam Kokendorfer, and William Miller. Commissioner Gershenson, you want to read it or you want me to?
Please, you can read it.
This is a request to suspension of the rules for immediate consideration in support of Oakland University's Strive for 45 Invest in Student Success campaign to adequately fund higher education in Michigan. Moved by Commissioner Gershenson, seconded by Commissioner Kokendorfer to suspend the rules. All in favor of suspending the rules, say aye.
Aye.
Opposed, nay. The rules are suspended. Moved by Commissioner Gershenson, seconded by Commissioner Kokendorfer. To move the resolution. Any discussion? Seeing none, Madam Clerk, please call the roll.
On the resolution, Commissioners Lubes,
Yes.
Markham,
Yes.
McGilvray,
Yes.
Middleton,
Yes.
Miller,
Yes.
Nelson,
Yes.
Powell,
Yes.
Quarles,
Yes.
Biz,
Yes.
Taub,
Yes.
Whitebird,
Yes.
Woodward,
Yes.
Zach,
Yes.
Gershenson,
Yes.
Gingell,
Yes.
Hoffman,
Yes.
Jackson,
Yes.
Kokendorfer,
Yes.
Kowal,
Yes.
Kuhn,
Yes.
Long.
Yes.
Mr. Chair, you have 21 yeas, 0 nays.
A sufficient number voting in the affirmative, the resolution is adopted. We got 3 more to go here. The next resolution, we're going to request the suspension of the rules to take up the amendment to the rules of Board of Commissioners, addition to section 15, special procedures during state of emergency. That was sent out to everybody, moved by Commissioner Gershenson, seconded by Commissioner Nelson, to suspend the rules. All in favor of suspending the rules, say aye.
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 Opposed, say nay. The rules are suspended. Moved by Commissioner Gershenson, seconded by Commissioner Nelson to take up the resolution. Any discussion? Seeing none, Madam Clerk, please call the roll.
On the resolution, Commissioners Markham,
Yes.
McGilvray,
Yes.
Middleton,
Yes.
Miller,
Yes.
Nelson,
Yes.
Powell,
Yes.
Quarles,
Yes.
Biz,
Yes.
Cobb,
Yes.
Whitebird,
Yes.
Woodward,
Yes.
Zach,
Yes.
Gershenson,
Yes.
Gingell,
Yes.
Hoffman,
Yes.
Jackson,
Yes.
Kokendorfer,
Yes.
Kowal,
Yes.
Kuhn,
Yes.
Long,
Yes.
Lubes.
Yes.
Mr. Chair, you have 21 yeas, 0 nays.
A sufficient number voted in the affirmative, the resolution is adopted. The next resolution, I'll be asking for a motion to suspend the rules for immediate consideration, is for the continuation of local state of emergency due to coronavirus pandemic. Is there a motion? Moved by McGilvery, seconded by
Whitebird.
Whitebird. All in favor of suspending the rules, say aye.
Aye.
Opposed, nay. The rules are suspended. Moved by Commissioner McGilvery, seconded by Commissioner Whitebird. This is the required authorization of the board to allow the state of emergency declared by County Executive Coulter to remain. Any discussion? Commissioner Tom.
Thank you, Mr. Chair. I've heard people say that this is a week by week, vote. In other words, it's only good for a week, or have we changed that?
Can you repeat that? We're having a little hard time hearing you. Commissioner Tom, we'll listen clearly. So just everyone be quiet. And Commissioner Tom, try again.
Thank you. I have to speak to you on the phone. As I understood it, this request must be renewed weekly. Is that correct?
That is not correct. It requires the board to take action to extend the emergency beyond 7 days. And so what this resolution does, the 7th day will be Friday, I believe. So this extends it through April 17th, which is a little bit beyond the orders that have come down. If we need to extend it further, we can. According to Corporation Council, we really only have one option to extend or not extend. And so this gives through April 17th the ability, so we don't have to come back every 7 days. Any other questions? Seeing none, Madam Clerk, please call the roll.
Okay, on the resolution, Commissioners McGilvery,
Yes.
Middleton,
Yes.
Miller,
Yes.
Nelson,
Yes.
Powell,
Yes.
Quarles,
Yes.
Biz,
Yes.
Cobb, Whitebird,
Yes.
Woodward,
Yes.
Zach,
Oh, you're on mute.
Yes. Yes.
thank you. Gershenson,
Yes.
Gingell,
Yes.
Hoffman,
Yes.
Jackson,
Yes.
Okendorfer,
Yes.
Kowal,
Yes.
Kuhn,
Yes.
Long,
Yes.
Lubes,
Yes.
Markham.
Yes.
Mr. Chair, you have 21 yeas, 0 nays.
A sufficient number voted in the affirmative. The emergency order, the state of emergency remains in place, and the motion passes. We have one last one. This is a resolution to appropriate emergency funding for coronavirus pandemic response measures on the amount of $1 million. I need a motion to move by Commissioner Lubes, seconded by Commissioner Gingell, to suspend the rules. All in favor of suspending the rules, say aye.
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 Opposed, nay. The rules are suspended. Moved by Commissioner Lubes, seconded by Commissioner Gingell to move the resolution. Is there any discussion? Commissioner Gingell.
Thank you, Mr. Chair. So just to make sure I'm clear, this is an incremental $1 million in addition to what was passed previously for the $500,000. Is that correct?
That is correct. There was a total, start of the fiscal year of $1.5 million in the pandemic response line item. And we appropriated $500,000, as you correctly said before, and this is the remainder of those dollars for the a total of $1.5 million Oakland County is putting towards responding to the pandemic.
Okay, and then just the other line for clarity. So then this does exhaust the dollars that we had allocated in the pandemic response line item in the budget. And if we need to come back for additional funds beyond the 1.5 million, you will have to find that somewhere. Is that correct?
That is correct. That's correct. I mean, I think it should be also noted, and I've talked to the executive, there will be every effort to recoup any type of federal response because as a result of the state emergency, the county emergency, to recoup as many of these dollars as possible. These dollars are necessary to make sure that our first responders and all the work that we're doing has resources right now to do the job. Commissioner Zach, I believe, raised her hand.
No.
Oh, nope, okay.
Chairman Woodward, can I ask a question? This
Yes,
is Long.
Commissioner Long. Yes, Commissioner Long.
Do we have an estimate of what we spent so far of the $500,000 from County Exec Dave Coulter or not yet? Like how much is remaining out of that $500,000?
I don't have that. In this resolution, it is requiring that finance receive a report of all the monies as a result of being spent on the COVID-19 pandemic. That would come.
Okay, so we will get something soon. I just requested if you hear anything, if you can just send us all a copy of what we, like
Certainly.
when you get
Yep.
it.
I
All
will
right,
reach
thank you.
out. I mean, I'll reach out to the executive and ask for that, and I know.
All
that-
right, thank you.
Yep. Any further discussion? Commissioner Spitz.
Yes, Mr. Chair, I think the last, further resolve says, ask for a monthly report
Correct.
on the county's financial response to this. You know when that starts? Is that going to be the end of March will be the first one or later?
I would read this, I mean, a monthly report sometime within this month. That's how I would read it. Sorry, I mean, passing this resolution. I don't believe we had that
Okay, so
language
some-
in the previous resolution.
Okay, so we should expect something by the end of this month for the first report.
I think that's reasonable, and I will formally request and copy all of you for such a report.
Thank you.
Right? Any further discussion on this? Excellent. Okay. Seeing none. I mean, I think this resolution definitely demonstrates Oakland County's commitment to do whatever is necessary to protect our residents and continue the excellent work that Oakland County's been doing to respond to this pandemic, and how we all pull together to help ensure that we get through this. Seeing no further discussion, Madam Clerk, please call the roll.
On the resolution, Commissioners Middleton,
Yes.
Miller,
Yes.
Nelson,
Yes.
Powell. Yes. Quarles,
Yes.
Biz,
Yes.
Cobb,
Yes.
Whitebird,
Yes.
Woodward,
Yes.
Zach,
Yes.
Gershenson,
Yes.
Gingell,
Yes.
Hoffman,
Yes.
Jackson,
Yes.
Kokendorfer,
Yes.
Kowal,
Yes.
Kuhn,
Yes.
Long,
Yes.
Lubes,
Yes.
Markham,
Yes.
McGilvray,
Yes.
Mr. Chair. You have 21 yeas, 0 nays.
The motion to appropriate an additional $1 million for the pandemic response passes unanimously. A sufficient number voting in the affirmative. The motion is adopted. Those are all the resolutions. I'm just doing a quick little check because usually there's one of 20 that will remind me if I've missed anything. And so you're all out there. And I'm looking to staff to make sure I got everything. Getting the thumbs up. Okay, that moves us on to unfinished business. There is none. Excuse me, that brings us to announcements. Are there any announcements commissioners want to make? Commissioner McGilvery. Followed by Commissioner Zach. Commissioner McGilvery, you're on mute.
Thank you, Mr. Chairman. I just want to say thanks to the staff for pulling this virtual meeting together. I think it's great and short notice at that, and they did a fantastic job. So thanks.
Correct. Commissioner Zach.
I wanted to do the same thing. And I also want to commend our whole emergency response team, our public health, our county exec. They have been amazing in responding to the multitudes of questions that have come my way that I'm throwing at them. So I appreciate our staff for everything that you've done, as well as our county exec team in public health and emergency response center.
Commissioner Taub. Thank you, Commissioner Zach. Commissioner Taub? Yes. Applaud, yes. Commissioner Taub, Commissioner Markham, Commissioner Gershenson. Commissioner Taub. Oh, an applause. There we go. Okay. Commissioner Markham.
Thank you, Mr. Chair. I just wanted to mention that my sister runs a call center for the Red Cross, and she told me today that they have had thousands of cancellations of blood donations, and to encourage everyone to, if you can, make an appointment and go donate blood. We need 36,000 pints a day in America, and they are way under served right now. So please give blood.
Thank you for that announcement, Commissioner Markham. Commissioner Gershenson.
Thank
How
you,
about Commissioner
Mr.
Lutz? Go ahead.
Thank you,
Commissioner
Mr. Chair. I just have to ditto Commissioner Zach's comments. As I listen to the national news, I am so proud of the efforts that are taking place in Michigan with our governor. And in particular, I think our county exec Coulter is really taking the lead in the state on recommendations with his team. And I'm so proud of our whole staff, the health department, emergency response. I think we're handling that. We're leading the state in an example of how to handle this. Thank you.
Thank you, Commissioner Gershenson. Commissioner Lubes, followed by Commissioner Miller. Commissioner Lubes.
I wanted to thank everybody for the support on the agreement between Honor Community Health and Oakland County. It is a time of need, and people will need more and more health care as we've seen today. So thank you, Mr. Chair, for explaining it to everyone tonight.
Thank you. Commissioner Miller.
Thank you, Mr. Chair. Real quick, Tuesday, the 24th, the American Arab and the American Arab Council needs help. It's downtown. It's 7 miles. Their food pantry for people to distribute pre-packed food. If anybody's interested, reach out to me and I'll get the time and any other info if you're interested. Thank you.
Thank you, Commissioner Miller. Any further announcements? Seeing none, I guess I'm going to make the last one. I'm so proud of this board that overcame all technology issues to be able to do this. Oakland County became the very first Board of Commissioners, County Board of Commissioners in the entire state to hold a virtual meeting, and I believe the very first government body to hold a virtual meeting like this. The governor's executive order that came down about 5:20 this evening that clarified and gave us the ability to do this. I think this is a demonstration for us to get into practice social distancing and continue to get the work done for Oakland County. So, seeing nothing else, I'm going to adjourn this meeting to April 7th, 2020 at 9:30 a.m. or I call the chair. Meeting adjourned.
Thank you.